Good afternoon, my name is Francisco Rojo. I'm a nurse practitioner student with Clemson University, and today we're going to do a presentation on an acute episodic illness. This patient is a pleasant, well-nourished and well-developed Caucasian male that comes to the office complaining of fever, chills, nasal drainage, and a headache. He said that this started 3 days ago, about Sunday. Today is Wednesday. And he started noticing a sinus congestion and a headache at that time. He treated his symptoms with OTC decongestant and Tylenol, and it somewhat improved his symptoms. But the next day his condition worsened and I was unable to work with a fever of 101.3. He also at that time complained of a mild sore throat and chills. The patient continued using his over-the-counter medication with little improvement, and that's why he came to the office stating that it gets worse at times and mostly at night. Today he also complains of a headache with associated sinus congestion and some pain near the ears. He denies an excessive cough and substernal pain, fatigue, and mucopurulent discharge or shortness of breath, more associated with lower respiratory infections. Pertinent negatives also include clear lung sounds, regular sinus rhythm, no lymphadenopathy or thyroid enlargement. His past medical history includes hypertension and seasonal allergies. He treats this with lisinopril, 10 milligrams daily, and he takes Zyrtec as needed. The family history is negative for any chronic illness, the respiratory or cardiovascular. The patient denies smoking or use of recreational drugs. He's sexually active, married, and drinks just occasionally. Vital signs are blood pressure 141/82, heart rate 81, respiratory rate 20, a temperature mildly elevated with 100.1, an O2 saturation of 96%, and a BMI of 26. Going to the cardiovascular, a regular rhythm and rate with no murmur, clicks, or drops. Carotid pulse normal and in upstroke and peak. Normal regular visible apical impulse, and S1 and S2 sounds with no splits are the aortic area. The pulmonary shows clear vesicular sounds in all fields. And if we move a little bit to the head, eyes, ears, nose, and throat, we see that he presents some tightness and pain on palpation of the face. The right ear sternal canal shows a little redness, and with a left ear tympanic membrane dullness. And the throat is reddened with a 2+ tonsils, and the nasal cavity presents mildly inflamed with no polyps. We will say that he has a differential diagnosis of acute sinus sinusitis. We will say also that bacterial sinus rhinosinusitis and the flu. A flu test was ordered, but it was negative. We also ordered a complete blood count, and the WBCs were elevated with a 13,500, neutrophils 65%, and bands 5%. These results show a moderate leukocytosis with normal range for neutrophils, indicating an infection, but with a good immune response from the patient. We will say that the symptoms, history, and findings lead more towards an acute bacterial rhinosinusitis. The patient was prescribed Zithromax 500 milligrams tablet PO daily for 3 days for the bacterial infection. Deltazone also was added, 20 milligram tablet, TID the first day, twice a day the second day, and one time the third day. This was for the inflammation part of the symptoms. Mucinex DN was also prescribed 600 milligrams, 1 or 2 tablets every 12 hours, to not exceed 4 tablets every 24 hours for the congestion. We also encourage the patient to rest, drink plenty of fluids, use a humidifier, and come back to the office if symptoms didn't improve or got worse.